All right, jumping right in. Today, we're doing a deep dive on breast cancer screening.
Oh, a really important topic?
It is. Every GP runs into it pretty regularly.
Yeah, absolutely.
We're going to go a bit beyond the basics, though, and really get into it.
Okay.
Looking at how effective the different screening methods are, what the latest strategies are, really how to take the research and apply it to your practice.
It's so crucial to stay updated, especially with breast cancer. It's so prevalent.
Yeah.
And, the technology's always changing.
It is. That's really true.
So,
Well, let's start with the foundation of it all.
okay.
Mammography.
Yeah.
It's been the go-to for such a long time.
Right.
But why? What makes it so effective?
Well, the evidence is really strong. We've got tons of randomized trials, some involving, hundreds of thousands of women, showing that it's the only imaging method that's actually been proven to reduce breast cancer mortality.
Okay. That's impressive.
Yeah.
And it's not just staying the same either, right? Mammography's seen some big upgrades.
Absolutely. We've gone from film mammography to digital mammography.
Right.
And now 3D mammography is becoming like the preferred method,
Oh, okay.
which is also called digital breast tomosynthesis.
Okay.
But basically what it is you're taking multiple X-ray images from different angles, which gives you a way clearer picture.
Okay, so it's like having a more powerful lens. So
Exactly.
you can spot those really tiny lesions.
Yeah, that's a great way to put it.
That might be dangerous.
And that's really important, especially for women under 50
Okay.
and those with dense breast tissue where the traditional mammography might not be as sensitive.
Right.
Studies show that 3D mammography can actually improve cancer detection rates in those groups significantly.
That's really good to know.
Yeah.
Because it's not just about ordering a mammogram.
Right.
It's about ordering the right kind of mammogram.
Absolutely.
Now, you mentioned dense breasts.
Yeah.
And I know that can be a real challenge when it comes to screening.
Definitely. So dense breast tissue can mask cancers on a mammogram.
Oh, wow.
So they're harder to see.
Okay.
And to add to that, having dense breasts is actually an independent risk factor for developing breast cancer.
This is like a double whammy for these women.
Exactly.
So how do we approach screening then for women with dense breasts?
Right.
Is 3D mammography enough?
Well, 3D mammography is definitely a big step in the right direction.
Okay.
It's much better at detecting cancers in dense breasts
Okay.
compared to the standard 2D.
Right.
But there are other options for supplemental screening,
Okay, like what?
like ultrasound or MRI.
Oh, okay.
Yeah.
I was going to ask about those.
Yeah.
Are they routinely recommended for all women with dense breasts, though?
Not necessarily.
Okay.
While they can be useful, they also have drawbacks.
Okay.
Like ultrasound can pick up benign lesions sometimes,
Oh, right.
which can lead to unnecessary biopsies
Yeah.
and anxieties. And then MRI, while it's very sensitive, it's expensive
Yeah.
and it can lead to false positives.
Okay.
So really it's
The decision to use supplemental screening needs to be made on a case-by-case basis,
right.
taking into account the individual's risk factors
Okay.
and preferences.
So it sounds like kind of like a balancing act.
Exactly.
Weighing the benefits
Right.
of potentially catching more cancers
Yeah.
against the potential harms of false positives or even overdiagnosis.
Exactly. And that's where shared decision-making is really important.
Okay.
We need to educate our patients about both the potential benefits and harms of each option,
Yeah.
and then work together to decide what's best.
Okay. That makes a lot of sense.
Yeah.
Now, speaking of overdiagnosis,
Yeah.
that's something I wanted to ask you about.
Sure.
It seems like kind of a counterintuitive concept.
Yeah.
How can finding cancer be a bad thing?
Right. Well, it's not about finding cancer being bad.
It's about finding cancers that may never have caused problems
Right.
if they hadn't been detected through screening.
Okay.
So some cancers are slow growing,
Right.
and they might never actually become life-threatening,
Mm-hmm.
but because we found them, they get treated.
Right.
And that can expose patients to unnecessary procedures
Yeah.
and side effects.
Okay, so it's not just about finding cancer early.
Right.
It's about finding the right cancers.
Exactly.
The ones that actually need intervention.
Precisely. It's a complex issue.
Yeah.
And there's ongoing research to develop better tools to differentiate between the aggressive
Right.
and the indolent cancers.
Yeah.
But for now, it's just really important to be transparent with our patients about the possibility of overdiagnosis
Yeah.
and make sure that they understand that treatment decisions are made on a case-by-case basis.
That makes a lot of sense.
Yeah.
Now, moving away from dense breasts for a second,
Okay.
let's talk about assessing a woman's overall risk for breast cancer. It's not just about age.
Right. It's not just about age.
What other factors do we need to consider?
So age is a big factor, obviously, because breast cancer risk increases with age.
Right.
But we also need to look at family history,
Okay.
genetic predispositions, reproductive history, and lifestyle factors. So there are tools like risk assessment models, like the Gale model and the Tyrer-Cuzick model that can help estimate a woman's individual risk based on all these different factors.
Okay, so those models take all those different pieces and kind of spit out a personalized...
Yeah, like a personalized risk assessment.
That's really useful. And you mentioned genetic predisposition, which makes me think of the BRCA genes.
Yes, the BRCA genes.
Which are
They're infamous.
Infamous, yeah.
Yeah, but it's important to remember that they're not the only genes that can increase breast cancer risk.
Right.
There are a whole host of other genes
Right.
that can play a role.
Right.
Though their impact may not be as strong as BRCA1 and 2.
Okay, so family history is crucial.
Yeah.
Even if we don't have, like, specific genetic testing results.
A strong family history, especially in first-degree relatives, significantly increases a woman's risk.
Okay.
And thankfully, genetic testing is becoming more and more accessible.
Right.
So we're able to identify those who might benefit from increased surveillance.
Okay.
Or preventative measures.
And I imagine those risk calculators can also give us some insight into whether a patient might be a candidate for genetic testing.
Yeah, so they can actually estimate a woman's risk of carrying a BRCA mutation.
Oh, wow.
Which can help guide decisions about genetic testing.
Okay, that's fascinating.
Yeah, it's a powerful tool to identify those who might benefit from further evaluation.
It's like we've got this whole arsenal of tools to help us personalize breast cancer screening for each patient.
We really do, and that's what makes this field so exciting. We're moving away from that one-size-fits-all to a more nuanced and individualized approach.
Now, before we move on to the next part of our deep dive, I want to ask you about something that I know a lot of patients and even some doctors still believe in.
Okay.
Breast self-examination.
Yes.
Is it really effective?
That's a great question.
Yeah.
And one we need to address.
Yeah.
So despite what a lot of people think, multiple studies have shown that breast self-examination, or BSE, isn't a reliable screening method.
Oh, okay.
It hasn't been shown to reduce breast cancer mortality or improve early detection rates.
Oh, wow.
And in fact, it can even lead to unnecessary anxiety and biopsies.
Because
of the increased detection of benign lesions.
So are we saying that we should be discouraging patients from doing breast self-exams altogether?
We're not necessarily saying to avoid it completely.
Okay.
So while BSE isn't a substitute for mammography or other proven screening methods, it can still be helpful for women to be familiar with their breasts and notice any changes.
Okay.
What we call this is breast self-awareness.
Okay, so it's more about being in tune with your body.
Exactly.
Noticing anything unusual.
Right.
Rather than doing, like, a structured exam every month.
Yeah, exactly.
Okay.
It's about empowering women to be active in their healthcare.
Okay.
And of course, any changes, no matter how small, should be reported to their doctor.
Okay, that makes sense.
Yeah.
So we've covered a lot of ground. Evolution of mammography, the challenges of dense breasts, the importance of individualized risk assessment.
Yes.
And this role of breast self-awareness.
A lot to digest.
It's a lot to digest.
Yeah.
But it's all essential for GPs.
Absolutely.
Who are on the front lines of breast cancer screening.
They are.
And we're just scratching the surface.
Yeah, we're just getting started.
In the next part of our deep dive, we'll explore the nuances of screening recommendations. Based on age and risk level.
Yeah.
And we'll also look at the benefits and drawbacks of different screening intervals.
Looking forward to it.
Yeah, should be good.
Okay, so picking up where we left off.
Right.
Let's dig into the nuances of screening recommendations.
Okay.
Especially how they change with age. So we know breast cancer risk usually increases as women get older.
Right. So logically, the screening guidelines have to take that into account.
Exactly.
So what are the recommendations then for women in different age groups?
Right. So for women aged 40 to 74, most major organizations recommend regular screening.
Okay.
However, there's some debate about the ideal frequency.
Okay.
Some advocate for annual screening, while others suggest biennial screening.
Okay, so like every 2 years.
Exactly, every 2 years.
Okay, so why is there that discrepancy?
Right.
It seems like catching it early is always better. So wouldn't yearly mammograms be more effective?
Well, It's not quite that simple.
Okay.
While annual screening might detect slightly more cancers,
Okay.
it also comes with a higher risk of false positives.
Right.
And those false positives can lead to, unnecessary anxiety, additional imaging,
Yeah.
even biopsies, which have their own risks and costs.
Right. So it's like with biennial screening, you're kind of balancing that potential for missing some cancers
Exactly.
with the benefits of having fewer false positives and less intervention.
Yeah, you're trading one off for the other.
Right.
And the choice between annual and biennial really often comes down to a discussion between the woman and her doctor.
Right.
It's about weighing the potential benefits and harms in the context of her individual risk factors and preferences.
It makes sense. It's not one size fits all.
Exactly.
Just like we were talking about before.
Mm-hmm.
Now, what about women outside of that 40 to 74 age range?
Mm-hmm.
What are the recommendations for younger and older women?
So for women under 40, routine screening isn't generally recommended.
Okay.
Unless they have, specific risk factors like a strong family history or a known genetic predisposition.
Right.
The reason being is that breast cancer is less common in younger women.
Yeah.
And the potential harms of screening, like false positives, might outweigh the benefits.
So it's a matter of really carefully considering the risk-benefit ratio.
Exactly.
For younger women.
Yeah.
What about on the other end of the spectrum?
Okay.
What about women over 75?
Right.
Do the benefits of screening kind of continue as they age?
That's where things get a bit more nuanced.
Okay.
The evidence for continued screening after 75 is less clear-cut.
Okay.
Some studies suggest that the benefits might diminish.
Okay.
And we also need to consider, a woman's overall health and life expectancy.
Right.
Yeah.
So it becomes more of an individual decision, taking into account factors beyond just breast cancer risk.
Precisely. So for these women, the decision to continue screening should really be made on a case-by-case basis, involving, a conversation about the potential benefits and harms, their overall health status, and their personal preferences.
It sounds like those conversations about screening after 75
Yeah.
could be quite complex and sensitive.
It can be.
Yeah.
Which is why it's really crucial to approach them with empathy and clear communication.
Yeah.
We need to make sure the patient understands the uncertainties and feels empowered to make a decision that aligns with her values and goals.
Absolutely. Okay.
Yeah.
Now let's switch gears a little bit.
Okay.
Talk about high-risk women.
Sure.
We've mentioned risk factors throughout our conversation.
Which have.
But when does a woman actually cross that threshold into the high-risk category?
Right. So generally, a woman is considered high risk if her lifetime risk of developing breast cancer exceeds 20%. And this could be due to a combination of things, like a strong family history, a known genetic mutation, or a history of chest radiation.
Okay, so for these women, we obviously need a much more tailored approach to screening.
Yeah.
So what does that involve?
So high-risk women often benefit from more frequent screening,
Okay.
sometimes even every 6 months.
Wow.
And they might also need supplemental screening with MRI in addition to mammography.
Okay, that makes sense.
Yeah.
Given their elevated risk.
Right.
And I imagine these women would also benefit from genetic counseling.
Absolutely.
And referral to specialized high-risk clinics.
Yes. Definitely.
Okay.
So genetic counseling can really help them understand their individual risk and explore options for risk reduction, which might include medications or even prophylactic surgery in some cases.
Okay.
And then the high-risk clinics can provide comprehensive care and personalized management plans that are tailored to their specific needs.
So it's a much more intensive and proactive approach.
It is, yes.
To screening and risk management.
Exactly. And it just highlights how important it is to identify these women early on so we can give them that appropriate level of care and support.
Now, I want to touch on something that we discussed earlier.
Okay.
The evolution of mammography technology. We talked about 3D mammography.
Yes.
Are there any other advancements kind of on the horizon?
Yeah, there are.
That could further improve breast cancer screening?
So there are some promising developments in the pipeline.
Okay, like what?
One is the use of contrast-enhanced mammography.
Okay.
So this involves injecting a special dye that highlights the blood vessels in the breast.
Okay.
So it makes tumors stand out more clearly.
Oh, that sounds fascinating.
Yeah, it is.
So it's like giving the radiologist a better view of the vascularity of the breast, potentially making it easier to spot those abnormal blood vessel patterns
Exactly.
that are associated with tumors.
Yeah, yeah.
Okay, cool. And what else?
So another area of research
Okay.
is focused on molecular breast imaging, or MBI.
MBI. Okay.
And so this one uses a radioactive tracer
Okay.
that's taken up by cancer cells,
Okay.
making them light up on the images.
Oh, wow.
And this can be really helpful in detecting cancers in dense breasts,
Okay.
where mammography might not be as effective.
Right. Okay. So these new technologies
Yeah,
sound really promising.
they do.
But are they ready for prime time,
Yeah.
or are they still in that research phase?
Most of them are still being studied
Okay.
and refined,
Okay.
but the early results are encouraging.
Yeah.
It's exciting to think about the potential they have.
It definitely gives us a lot to look forward to.
It does.
Now, before we wrap up this part of our discussion, I want to circle back to something that's been kind of woven throughout our conversation.
Right.
The importance of communication.
Yeah.
Can you just elaborate a little bit on why that's so crucial
Sure.
in the context of breast cancer screening?
So effective communication is really paramount in every aspect of healthcare.
Yeah.
But especially when it comes to breast cancer screening.
Okay.
You know, we're dealing with a topic that's often full of anxiety and uncertainty
Right.
and personal values.
Yeah.
So we need to be able to explain the risks and benefits clearly, address patients' concerns sensitively,
Yeah.
and empower them to make informed decisions that align with their individual circumstances and preferences.
So it's about building a partnership with our patients.
Exactly.
Not just dictating what they should do.
Yeah, it's about shared decision-making, where we provide the information and the guidance and the support.
Yeah.
But the patient ultimately decides what feels right for her.
Right? Okay. Well said.
Thank you.
I think we've covered a lot of ground in this segment.
We have.
We've talked about those nuances of age-based recommendations, the complexities of screening high-risk women,
Right.
and those exciting advancements on the horizon.
We have. And in the final part of our deep dive, we'll explore some specific scenarios and case studies to illustrate how these concepts play out in real-world practice.
Looking forward to it.
Yeah, it should be good.
Okay. So we've gotten really deep into the science, the stats, the whole evolving landscape of breast cancer screening.
We have.
Now let's bring it all together
Okay.
and talk about how all this knowledge actually translates into real-world practice.
Yeah.
What are some of the challenges that you face when you're talking about breast cancer screening with your patients?
Well, one of the biggest challenges is navigating the sheer volume of information that's out there.
Oh, yeah.
Patients often come in feeling overwhelmed. You know, they've read all this conflicting advice online, or they've heard different opinions from friends and family.
It's that information overload
Exactly.
that we all struggle with.
It really is.
So how do you cut through the noise?
Right.
And help your patients make sense of it all?
Well, I find that taking a personalized approach is key.
Okay.
It really starts with listening to their concerns,
Right.
understanding their values, and assessing their individual risk factors. And then we can discuss the potential benefits and harms of screening in a way that feels relevant to their situation.
That makes sense. It's not just about, presenting the guidelines.
Right.
It's about tailoring the conversation
Exactly.
to the individual patient.
For example, a woman with a strong family history of breast cancer might be more willing to accept the risks of false positives or overdiagnosis if it means increasing her chances of early detection.
Right.
Whereas a woman with no family history and a lower risk might prioritize minimizing unnecessary interventions.
So it's all about finding that sweet spot.
Exactly.
Where the benefits of screening outweigh the potential harms.
Yes.
Based on their individual circumstances.
Yeah. And sometimes those conversations can be, emotionally charged.
I can imagine.
Especially when you're dealing with high-risk patients or those who've had, previous negative experiences with screening.
Right. So it's a lot more than just ordering a test.
It really is.
It's about providing guidance, support, and really, really just empathy.
Absolutely.
Now, let's talk about some of the emerging trends in breast cancer screening that we touched on earlier.
Yeah.
We discussed the potential of contrast-enhanced mammography and molecular breast imaging.
Right.
Where do you see these technologies fitting into the landscape in the future?
Well, I think these advancements have the potential to really revolutionize how we approach breast cancer screening.
Okay.
Imagine a world where we can pinpoint tumors with even greater accuracy, reduce false positives,
Right.
and tailor screening intervals based on individual risk profiles.
So the future of breast cancer screening is all about precision
It
and
is.
personalization.
And we're seeing a shift towards risk-based screening,
Okay.
where women at higher risk are screened more frequently and with more sensitive tools,
Okay.
while those at lower risk
Yeah.
might be able to space out their screenings
Right.
or use less intensive
So
methods.
it's moving away from that one-size-fits-all
Exactly.
towards a more tailored strategy.
And artificial intelligence is playing an increasingly important role, too.
Okay.
Yeah, so AI algorithms can actually help radiologists
Wow.
analyze mammograms more efficiently, which could potentially improve accuracy and reduce human error.
So technology really is changing the game when it comes to breast cancer screening.
It really is.
But it's important to remember that technology is only one piece of the puzzle.
Absolutely. The
Correct.
human element,
Yeah.
that doctor-patient relationship built on trust and communication and shared decision-making,
Yeah.
that's always going to be paramount.
That's a great point. We can have all the fancy technology in the world,
Right.
but it's meaningless if we don't have
Next
that human
point.
connection.
Yeah.
So as we wrap up this deep dive
Right.
into the world of breast cancer screening, what are some key takeaways that you want to leave our listeners with?
Well, first and foremost, remember that breast cancer screening is a dynamic field.
Okay.
The landscape is constantly evolving.
Right.
So stay curious, keep learning, embrace the new advancements that are coming.
It's that reminder to never stop being a student.
Exactly.
Even when you're the one wearing the white coat.
Yeah.
What else?
Second, always prioritize individualized care.
Right.
So take the time to understand your patient's risk factors, their preferences, their concerns, engage them in shared decision-making,
Yeah.
and empower them to choose the screening approach that feels right for them.
So it's about moving away from that paternalistic approach
Right.
towards a much more collaborative partnership.
Exactly.
Anything else?
And lastly, never underestimate the power of communication. Take the time to explain the nuances of screening.
Yeah.
Address those fears and anxieties with empathy.
Right.
And build trust through open and honest dialogue.
It's about remembering that we're not just treating a disease.
Right.
We're caring for a human being.
Well said.
I think that's a perfect note to end on.
Yeah, I think so too.
This has been an incredibly insightful journey into the world of breast cancer screening.
It has.
From those historical foundations to the cutting-edge advancements that are shaping the future of this field. Thank you so much for sharing your expertise with us.
It's been my pleasure.
And to our listeners, thank you for joining us on this deep dive.
Yes, thank you.
We hope you found this information valuable and that it empowers you to approach breast cancer screening with confidence and compassion.
Absolutely.
Until next time, keep diving deep.